Testing, testing, testing. Okay. Okay. Thank you, Linda, telling us sound is good. Yes, I'm in a new setup, so I want to be sure there is no technical glitches. Good morning. Today is Saturday, January 15th, 2022. This is our regular yoga therapy session. As most of you know, I am now conducting the session virtually. I shifted my residence to Bethesda, Maryland. Everything we present in this session is from our vast experience and also from our research. So today's topic is transformative power of the conscious breath. Sounds a big word, but let me explain to you these words we are talking about. Then we'll go with our regular practice, the one we learn from our experience. What is our experiences today? The people with underlying chronic lifestyle related disorders, what we call a metabolic syndrome, truncal obesity, diabetes, hypertension, coronary artery disease, dyslipidemia, or high cholesterol, with a regular and daily practice of pranayama. Pranayama, remember one thing I always emphasize, it is not a breathing exercise. It is a voluntary, regulated, conscious breathing. With the practice of pranayama, we have seen hundreds and hundreds of people who are getting better with the reduction in the blood sugar comes down, reduction in the blood pressure comes down. They get a very good result with the people with coronary artery disease, with the high cholesterol, high triglyceride, low HDL. We have seen all the lifestyle related disorder, and also this truncal obesity also goes down. Now let me clear with you from the beginning, the pranayama, prana is a life force, yama is a control and restraint. Pranayama is the fourth limb, and you prepare your body and mind with the asana practice, which is purely a relaxation response. And the asana for yoga therapy is called sthiram sukham asanam. Stillness, happiness, and able to stay in the pose for a long period of time. This will prepare your body and mind for a proper, effortless pranayama practice. There's a difference between exercise and yoga. Exercise is a sympathetic response. It's a muscle contraction. It causes increase in the heart rate, increase in the blood pressure, increase in the respiratory rate. When the sympathetic tone goes high up, body starts creating parasympathetic tone, and the effect of parasympathetic tone is a healing effect of exercise. So in exercising, we're not concerned, we are a little concerned that how high the heart rate is going high up, but you're more interested to see how fast that heart rate comes down. Even a coach will look at an athlete, will see that what is your resting heart rate. Yoga practice, on the other hand, is a relaxation response, activation of the parasympathetic tone. You will see, like me, you will have a saliva in your mouth. Saliva in your mouth is your activation of parasympathetic tone. The speed and the rate of pranayama has nothing to do with the practice. The only practice of pranayama is an effortless ease, as if it is your normal breathing. So when you will see we are doing a very faster Bastrika Pranayama, or doing a very faster even inhalation and exhalation, we are still talking, we are still singing, we are totally effortless. And that is the effortless breathing technique, voluntary regulated breathing. You have to continue. Breathing is both conscious and subconscious. We are sleeping, we are breathing. That is the function of our brainstem, which is your subconscious breathing. When you're awake and alert, I can breathe out. Take a long, deep breath in. Exhale longer than inhalation. This is a function of my cerebral cortex, of my brain, which is called a conscious brain. So breath is connecting between brainstem and the cortex, is connecting between subconscious and the conscious state of mind. And that's why I say breath is a connector between body and mind. And always use this metaphor. If you're flying a kite, the roller in your hand is the body, the kite is your mind, and the thread connecting the roller and the kite is your breath. So our first experience is, if you're able to sit down comfortably, which is called a sthiram sukham asanam, stillness. I'm sitting here cross-legged, I can sit in a chair, and here is my tool. You know, this is called a kneeling stool. I use the kneeling stool all the time. The reason for that is to keep your spine straight, called Merudanda Achal. If you sit down in a chair, keep your spine straight. If you sit down in the ground, able to sit down, keep your spine straight. Able to sit down without any pain, without any discomfort. Maybe a little bit what is called a comfortable discomfort, then able to change your leg and able to be comfortable also. This is called activation of the both sides of the brain. After you are seated properly with spine straight. Then you say mind control, manasthit. Mind control comes from your breath. Mind control comes from your hand gestures called mudras. Hand connects between your body and the mind. As you always know, if I want something, I put my hand first before I even can speak. If I like something, I'll say this thing before I can even, my word comes out from my mouth. So able to connect the two fingers, it is called index finger and the thumb. This is called a Gano Mudra or a Dhanu Mudra, or we call a meditation mudra. It quiets down our mind. Put it on the, just simply put on your knees. Sitting in a chair, you will be able to do it. Then the mind in yoga is the activation or content of our five senses. When activation in the contents of our five senses, we get the activation of our mind. Give me one moment, my computer, I'm getting a lot of, I don't know what information I'm getting. Let me, sorry, put the computer on do not disturb, so no signal is going to come. Okay, sitting comfortably, sthiram, sukham, asanam, touch your index finger and thumb, then close your eyes, because the five senses, I hear, I see, I smell, I taste, and I touch. The five senses keeps me awake and alert, closing my eyes. That first conscious breath. And what we have noticed is that the transformative power. What is the transformative power? In yoga, the Sanskrit word says it transforms from a rogi. Rogi means person who has an underlying chronic lifestyle related disorders, to a nirogi. Nirogi means person who has no disease. Then transform into yogi or yogini with a person who is healthy, well, and enjoying a good quality life. So transformation takes place with the conscious breath. Lung is like a balloon. It has 6 liter capacity. It needs 1.5 liter to keep it open. It's like a balloon. Okay, 4.5 liter of air which you can exchange when you're breathing in and out, of which for a normal breath we only breathe 500 milliliter or half a liter. So 80 to 90% reserve in the lung. So our first conscious breath is able to learn to breathe out a totally relaxed situation. With absolutely no effort. Remember, effortless breathing is you are able to talk, able to sing the way I'm doing. Next, you slowly breathe in, again effortlessly, as much as you can. If you're practicing with me, try. Take a deep breath in, then breathe out longer than breathing in. When you breathe out longer than breathing in, That means you expel more carbon dioxide or all the toxins in the lung and able to breathe more oxygen in. The way we teach to our participants in our session is that if you have a trouble focusing on your breath, just focus on a number. Like first, initially you start, breathe out with a count of 4. 1 and 2 and a 3 and a 4. Breathe in with a count of 2 in. 1 and 2 in. Again, breathe out with a count of 4. Easily you can do it when you put your mind in focus. This is called breath-centered meditation. This conscious breathing effort takes you to a state of meditation. Then what you can do, slowly you start increasing the timing. This is called neuroplasticity. The muscles which controls our breath are called skeletal muscles. The muscles can be trained. Like we can train our skeletal muscles during weight training, during running, during exercising. So giving an example, or if you're practicing with me, and let me jump a little bit, show it to you how we can progress. Next I will do count of 4 in, count of 8 out. Always in yoga practice, breathe out first. Count of 4 in. Count of 8 out. I practice every day, so this becomes very effortless for me. Say I'm talking. I almost have absolutely no effort in breathing. Remember, breathing also takes a lot of work. The work of breathing is extremely hard. Next, I'm just going to give you an example, but you practice slowly. You do a count of 2 in, 4 out, 3 in, 6 out. Give some time. 1 week, 2 weeks, 3 weeks in between, you'll be able to do it. Let me show it to you. Count of 6 in, count of 12 out. Breathe out first. Count of 6 in. This was count of 6 in, count of 12 out. We can even do count of 10 in, count of 20 out. Since you're progressing, let me show you one time. Count of 8 in, count of 16 out. Breathe out first. Breathe out first. This was count of 8 in, count of 16 out. Feel a profound level of relaxation. My mind is totally concentrated. So when you can do that, when you keep on practicing, that neuroplasticity, which is called a habit forming, our brain changes in structure and function. You'll be sleeping like this even when you're sleeping. And when I'm in state, I can feel I'm in a meditative state. I feel the capillary pulsation on my finger. I feel there is a numbness when I'm touching my finger. This is the state of your mind getting quieting down. Once you keep learning, breathing out longer than breathing in, with keeping your spine straight and quieting down your mind, you will see if you put your health parameters, which you use all the time. I wear an Apple Watch, you will see your heart rate is coming down, you will see your blood pressure is coming down, you will see your respiratory rate coming down, you will see your oxygen level is going high up, called SaO2. So this is even good enough at the beginning of your breathing practice. Before also doing that, in every morning, after brushing our teeth, scraping our tongue, I also practice your neti part, jal neti. Take a little bit of a part, a neti part, put a little warm water with a non-iodized salt. I wash one side of the nostril, other side, blow away all the mucus, retained mucus. Can I have an evenly open both sides of the nostril? And during this practice, you also have a little bit of water might come out, which is entirely normal. Once you stabilize, breathing out longer than breathing in, then you start doing a set of pranayama practice consciously for this transformation from rogi to nirogi to yogi, from a disease to no disease to a healthy, well person. First pranayama is called Bastrika Bellows. Bellows is the one which is used for your fireplace or for the blacksmiths. It opens up with the air in and then pushes out. So active inhalation. If you practice it with me, you can do it. In fact, we do a active inhalation, active exhalation, even during our asana practice. If you're doing a sit-ups, we'll do active inhalation and active exhalation with the sit-ups. If you do push-ups, we'll do active inhalation and active exhalation. When you're also doing it, we do both sides equally. Like if you want to see it, that what is the yoga therapy? Yoga therapy also activating both sides of your brain. As I always say, if you're using always your right hand, always your left hand. So you see this. I will be breathing in, then breathing out. And I'm giving an example. I do it a lot more, but I'll give you a 10 or 15 each so you can see. I'll be breathing in, breathing out. Then I'll be breathing in, breathing out. So here, first example is Bastrika. So this is one. To balance it, you do completely opposite. Now it will be here, breathe in, here, breathe out. You could do all this thing, active inhalation, exhalation, all different ways. If you relax, like the hand, when you do baby fist, or Balu Mushti Mudra. Balu is the baby, baby fist. When you do baby closes the fist, the thumb inside and close. You get a profound relaxation of your hand, profound relaxation of the upper part of the body. So from here, you can do just simply not moving your hands, just moving your little shoulder. Example, I will do a lot more. I will do 50, 60, 100 like this, and I'll show you a little example. Then I will also incorporate lower part of my body as a relaxation. So I will go ahead and progress with this is called your half lotus or the Padmasana. I put my hand in between my toes. This relaxes your toes. Remember the toe, the separation of the toes. Separation of the toes is the most important a relaxing technique, and market is full of it. Yoga toes, yoga shoes, yoga socks. So I'll put my one hand and I'll put my other hand here. So I'm separating all the fingers. And with this posture, what I will do Bastrika Pranayama like this. So I did 50 of them completely effortlessly. I'm talking, I'm breathing, I'm feeling a profound level of relaxation. To balance it, I'll do the same thing with the opposite side. Now I'm taking the feet out here, I'm taking the other feet higher. Remember, health is a balance of your body, mind and spirit. The moment you start practicing balancing, even the most important called alternate nostril breathing, or balancing your Bastrika Pranayama with balancing both sides of the body, you will see the transformation. This is the transformative power of your conscious breath. Again, put my hand here, separate my toes, put my hand here, separate my toes. I'm in a profound relaxation response. Then I'll show it to you, see how much I can do at a speed. Remember, people always ask me, you're doing too fast, you're doing too... No, it is not doing it fast. I started very slowly. I started like this. I may have started doing only 5, I'm at 10. But with the conscious breathing, I'm able to do it a lot more and a lot longer. So let me see how long I can do without any effort in breathing. Let me show it to an example. I did 100 of them. I can still continue a lot more. I just want to show with 100 I'm still talking. I may be singing. I'm whistling. I have no effort in my breath. So that gives you the whole your yogic healing power of your pranayama, the transformative power. The whole lungs gets completely clear. Now I can take a deep breath in and breathe out. I can breathe in and out maybe about 3 or 4 times more than a normal breath. Bastrika Bellows, it is a powerful tool for intrinsic pulmonary disease, like your lung condition, asthma, COPD, pulmonary fibrosis. Wonderful. Even if you can practice it very faster speed, but effortlessly. Remember, effortlessly. Disease is spelled D-I-S-E-A-S-E. Disease. Treatment of disease is effortless ease. Again, I can show you another little example how fast Bastrika is done completely effortlessly with a profound effect on your body and mind, profound effect on your metabolic syndrome. And remember, you have to do it daily. There is no shortcut. You can do a little bit of asanas, you can change a little bit of asanas, we do all the time, but we do not change our pranayama routine. Every single day I do pranayama routine. Now let me show you a little faster Bastrika Pranayama without any effort. I did 500 of them. I'm totally effortless. I can continue if a lot longer. The whole body is warm. I'm feeling hot. This also causes some hyperventilation syndrome. You get a little altered level of consciousness that is called due to cerebral vasoconstriction. Blood supply to the brain restricts. It also causes some circummoral numbness, some spasm in your hand called carpopelvic spasm. You get a lot of other symptoms with hyperventilation syndrome, but please don't worry. If you're effortless in breathing, that hyperventilation syndrome is not going to bother. In fact, you'll get a better and better effect. But look at simple way why to improve your breathing. Number one, when you do a longer inhalation, longer exhalation, you reduce the rate of your breath. Normally breathing between 15 to 16 a minute. The moment you can do 2 seconds in, 4 seconds out, your rate is already 10. If you can do 4 seconds in, 8 seconds out, rate is between 5. Slower the respiratory rate, longer is your longevity. Longer your exhalation, longer your longevity. Inhalation is sympathetic, exhalation is parasympathetic. As simple as it is. Also, on the other hand, person who is dying, last breath come out, he said expire. When the lung stops, then the heart stops. And lung and heart is the same organ in yogic description. When the heart stops, then the brain stops. When your brain stops, your cellular function stops. Able to improve your respiratory function, improves your heart function, improves your brain function, improves your cellular function. As simple as it is. So if you have diabetes, your beta cell in pancreas is not working, able to improve your pulmonary function, able to reduce your blood sugar by improving the function of the beta cells. We also do the Bastrika Pranayama with our hand raising high up. Initially we do it very slowly, then we do it in a different speed, and we do it in sequence and in your cycle. Like initially we'll do breathe out first, take a deep breath in, breathe out slowly with your baby fist. Slowly we'll increase our speed. We do a slow speed. Generally our cycle is we do a 20 on a slow speed, then we'll do 20 in a medium speed, 20 in a rapid speed. That will be our one cycle. And after one cycle, then we'll repeat the cycle. 1, 2, 3, 4, that I do it every practice. Let me show you just one cycle so you'll understand what I mean. Slow speed, 20 of them. Medium speed, another 20. A rapid speed, another 20. So one cycle of your Bastrika Pranayama. By the time you're able to practice like this, it's a wonderful practice for your transformative power and overcoming all the underlying diseases. Little bit of nasal drainage is entirely normal when you do a morning Jatneti. This is called your Prano Pradhan Pranayama. Prana means your life force. It's a subtle energy which keeps us awake, alert and alive. This pranayama brings prana in your body. Next one is called Kapalbhati Pranayama. In a Kapalbhati Pranayama, you put your focus in the belly button. There is a balloon. Push the belly button in. It will restrict this balloon. It will hit the diaphragm. Another balloon in the lung. Air will come out. We practice this pranayama with the hand mudras. Generally about 8 to 10 mudras we use. This is called Dhanu Mudra or Ganu Mudra. Index finger down, called a Vayu Mudra. Controls your vata, the pain. This is your Shunda Mudra. Improve your hearing. This is your Prithvi Mudra. Grounding, controlling your kapha, like your obesity, truncal obesity, diabetes. Varun Mudra is water content. Improves your bladder function, the whole circulation of the body and the skin function. Touching ring finger, little finger and thumb. This is your Shakti Mudra, strength. Wake up in the morning, you have enough strength to the Shakti Mudra. Middle finger, ring finger and thumb, Apna Mudra. It is also called a Pachun Mudra. It is called a digestion Mudra. Removes all the toxic material, undigested material from your body. Index finger down is called the Apna Vayu Mudra or called Hridaya Mudra. Good for your heart and lung function. Hands together, it's called a Linga Mudra. It is heating. Children should do, very good for when they have a runny nose, cough. Ganesh Mudra, a lot of mudras are there. This is called a Hakini Mudra, the Shankha Mudra. This is your Dhenu Mudra, alternate function. I've shown you, do another mudra with you. But we do the pranayama with every mudras. I generally do the 50 with each mudras. So let me show you about 10 or 20 in each mudras. Always put awareness in a belly button. Push your belly button to the back. Air will come out. If you want to practice, you see the patents of both sides of a nostril. You can close one side and see if your air is coming. Close the other side and then see. For me, both sides is equally open. And when you try yours, you will see your one side is more open than the other side. That's pranayama brings evenness in breathing in both sides of the nostril. Let's show you practice. I'll do 20 in each mudras and I'll tell you the benefit of this. This is also called a metabolic pranayama. This is called Agni Pradhan Pranayama. It ignites your digestive fire. It ignites your inner fire, which is called a tejas. The name called Kapalbhati. Kapal is a forehead, Bhati is a shining. When you remove all the toxic material from your body, you are glowing. People will say, hey, when you do practicing, you are glowing. You look a little different. Did you get a facelift done? So start with these mudras, spine straight, eyes closed, mind quiet. I'm going to do it. Please do it with me if you're doing it, and I'll tell you the benefit. Awareness in the belly button going to the back. Next mudra is the Vayu Mudra. Now you noticed, you keep on doing it, let me tell you, it's an active exhalation. I've been exhaling, I was not inhaling. I was inhaling in between exhalation without knowing. I don't need to learn how to do a breathing in. The day I was born, I took a deep breath in. I have to learn how to breathe out. Next mudra, another 20 counts. Very slow, 1 per second, no rush, completely effortless. Vayu Mudra, and I'll tell you the benefit, you keep on doing it. It massages all the internal organs. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon, massages your small intestine. For the women, massages your uterus, massages your tubes, massages your ovaries. For men, it massages your bladder, and both men and women bladder. For men, it massages your prostate. Massages all the intra-abdominal organs. Next mudra, Prithvi Mudra, very good for truncal obesity and diabetes. It also massages your diaphragm, which is high up. Above the diaphragm is the 2 lungs and the heart. Massages your lung. So all the toxic material comes out through your lung. Remember, all the toxic material in our body comes out with a stool, with a urine, with a perspiration. The Kapalbhati Pranayama is the only pranayama where you can remove all the toxins in your body consciously and voluntarily. Conscious removal of toxin, effect of your conscious breath for transformation. In between the lung, you also have a heart. It massages your heart. Massages your heart very gently. We always massage our heart when the organ, in yoga, any organ function improves when you massage it. When the heart stops, we do a CPR, cardiopulmonary resuscitation. Chest compression, basically massage the heart. When the heart stops, come to emergency room. We even used to do a open the chest called left thoracotomy and manually hold the heart and pump it. Next mudra is your Varun Mudra, which helps in the water, bladder function, the water. In fact, the more fluid and blood comes to skin, very good for skin function. So it massages your heart internally, very slowly, very effective for your improving your heart function. I call it your internal CPR, internal cardiopulmonary resuscitation. It also increases the negative intrathoracic pressure, means the pressure in the chest becomes more negative. There is a better venous return to the heart. It is called a better preload. And by activating parasympathetic tone, it causes your peripheral vasodilation, relaxation response, reduction in peripheral resistance, and increases your afterload. Reduces your afterload. increases your preload because more blood is coming into heart, reduces your afterload by reducing the peripheral resistance. Next mudra is your Shakti Mudra. So when I do it, I'm not talking totally effortless. I do a 50 of this Kapalbhati Pranayama with each mudras. This is for all the metabolic disorders in our body. People who are doing it alone, they reduce the truncal obesity. When the truncal obesity is reduced, as you know, cortisol level goes down, or mental fat starts reducing, pro-inflammatory molecule comes down. Next mudra, Abdominal Mudra. So when inflammation is down, diabetes gets better, blood sugar starts to come down, blood pressure starts to come down, hypertension starts getting better. You get a coronary artery dilatation, blood vessel in the heart opens up, which causes proper function of the endothelium, called endothelial function. When there's endothelial function, you improve, you increase more nitric oxide. Nitric oxide is a potent, powerful vasodilator. Index finger down is called Hridaya Mudra. It is for your heart and lung function. So stop here. Linga Mudra, it generates your heat, very effective for your cough and cold for your children. Wonderful therapy for your metabolic disorders. Next is alternate nostril breathing. These are the three main pranayama which we do not compromise. Every day we do 1 hour, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. You start doing exactly the amount of pranayama you can do completely effortlessly. Slowly and slowly we'll start increasing the time. Bastrika you can do 3 to 5 minutes. Kapalbhati you can do 5 to 10 minutes, sometimes 15 minutes. Has to be effortless. Left hand with Dhyana Mudra. Right hand, you close your right nostril. You don't have to close all the way down, just little underneath. Breathe out through your left nostril. Then breathe in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. Then you continue the alternate nostril breathing. If you're practicing with me, keep doing it with me, and I will tell you the benefit of this pranayama. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female, right brain is cooling, right brain is parasympathetic. Left nostril breathing is called your Chandra Nari, moon energy, moon channel. It is cooling, parasympathetic. Right nostril is controlled by the left brain. Left brain is male. Left brain is analytical. Left brain is heating. Left brain is sympathetic. Right nostril breathing is called your Surya Nari, sun energy, sun channel, sympathetic. It activates both sides of your brain. Excellent pranayama for your dementia, improving your memory, hypertension, water-related disorder. Next you do, many a time you feel a bit uncomfortable in your elbow, you can put it on sometimes on a small stool to support, or many a time you can use your left hand to support your right elbow. Put your index finger and middle finger in between your eyebrows, the third eye, and continue alternate nostril breathing with a focus in the third eye. Within a short time, you will be in a transcendental state and you will have absolutely no idea what you are doing when you are doing. Totally do it effortless. If you can do it, 5 to 10 minutes is great. Then you can use the left hand, hold the right ear lobe. This is called your super brain yoga. It balances both sides of the brain. By balancing both sides, by doing alternate nostril breathing, you will essentially see your both the nostril has opened up. When both the nostril is open, when you are breathing through both the nostril, it is a heavenly feeling. Continue this as long as you can do it completely effortlessly. Then what you can do, you can incorporate a little bit of breath holding in alternate nostril breathing, Nadi Shuddhi Pranayama. We generally do it 1:4:2. Like we will do breathe in for a count of 4 in, we'll hold for a count of 16, breathe out with a count of 8. Breath holding, I'll show it to you. It causes little increase in the volume of the lung and it causes little stretching, but lung cannot expand too much. Then it goes back to its original shape. It is called a herring-brewer reflex, which is activated by the vagus nerve, and vagus is a parasympathetic. We use what we call a Vishnu Mudra. Put your index middle finger down, make a pinch. Put the pinch in your nostril, close your right nostril, breathe out through your left nostril, breathe in with a count of 4 in. Close both the nostril, a count of 16. Breathe out through the right nostril with a count of 8 out. Breathe in through the right nostril with a count of 4 in. Hold your breath, count of 16. Breathe out through the left nostril, count of 8. Very simple and easy for me with 1 round of Nadi Shuddhi Pranayama. Breath holding in inhalation, breath holding in exhalation. Both are is a wonderful practice to your transformative power. I can keep on doing it, but I keep the same ratio. Then I will do a count of 5 in, 20 hold, 10 out. 6 in, 24 hold, 12 out. And slowly increase as much as I can. When you practice breath holding, use breath holding with your called bandhas, called the locks. Like when you keep your spine straight, put your chin down, touch your chin to the chest. This is called your chin lock, Jalandhar Bandha. It activates your carotid sinus, activates a profound relaxation response by taming cardiovascular system and a nervous system. When you do abdominal lock, you will do an abdominal lock or Ujjayi Bandh with a breath holding in exhalation. This pranayama is called a Murcha Pranayama. Murcha is unconscious. It is so relaxing, it feels like you're totally unconscious. Let me show you one example so you'll be able to do it more and more. Breathe out first. Take a deep breath in and hold your breath. And slowly drop your chin down, bring your chin towards your chest. Keep holding your breath and keep counting how long you can hold. It's called Murcha Pranayama, breath holding and inhalation. The profound activation of vagal tone. Breath holding and exhalation is called an abdominal lock or Ujjayi Bandh. Technique is breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. I also practice with this, with a chin lock, Jalandhar Bandha, and a root lock, Mula Bandha. It's called a great lock, Mahabandha. I practice all the 3 locks with your Ujjayi Bandha, or abdominal lock. Wonderful practice. Keep doing it. You will see you'll overcome any kind of disease you have in your body and mind. Next to quiet down your mind is called your bumblebee breathing or Bhramri Pranayama. Remember 5 senses, we shut down our 5 senses. My brain has a frequency, I create a frequency by bumblebee. 2 frequency cancels. It is called your harmonic resonance and your mind totally quiets down. Index finger in the forehead. You can do a Shakti Mudra, or also you can do 3 fingers to close your eyes. Use a thumb to close your ear and you close your mouth. You breathe out first. Get deep breath through your nostril and breathe out with the sound of a bumblebee. Remember, always breathe through your nostril. We generally practice between 5 to 7, sometimes 10 daily practice. This followed by the thumbing and cupping. Keep rubbing your hands, when you follow the profound, the heat on your hand. So wearing glasses, remove your glasses, put your hands over your eyes, let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your face. And all the muscles of the face are under your skin. The muscle gets relaxed, all the wrinkle goes away, all the lines goes away. Slowly massage behind your ear, in the earlobe, called auricular branch of vagus nerve. It stimulates vagus nerve, parasympathetic response. Bring your hand down, massage your carotid sinuses, both sides of the neck, relaxation response. Take your hand back, massage your back. It's the insertion of trapezius and sternomastoid muscle, which is supplied by the cranial nerves. It is a very wonderful practice for your neuropsychiatric disorders, cardiovascular disorders, able to quiet down your mind. Ujjayi Pranayama, you are able to learn how to close your larynx slowly and able to breathe in and out. It will sound like a sound of your ocean breath. We call it a dark weather breathing. Then slowly and slowly you tightens up more. Then we try to breathe in, you will hear a sound. It is a completely effortless practice. Larynx is supplied by the superior and inferior laryngeal nerve, which are branches of vagus nerve. Vagus nerve, 80% is your afferent. That means it goes to your brainstem. When it goes to brainstem, the efferent, which comes out from the brainstem, comes out to a glossopharyngeal nerve and a hypoglossal nerve, two cranial nerve. Glossopharyngeal nerve supplies your palatopharyngeus and palatoglossus, muscles of your soft palate, tightens it up, is a very powerful tool to control your snoring, because snoring comes from the soft palate. It also activates your hypoglossal nerve. Hypoglossal nerve supplies your tongue, pushes the tongue in front. It is a wonderful tool for your sleep apnea. The bumblebee breathing or Bhamri Pranayama is a wonderful tool for your insomnia. Insomnia is the root cause for all of our metabolic syndrome. And Ujjayi Pranayama is a very powerful tool for your sleep apnea. Ujjayi Pranayama is done along with your chin lock and left nostril breathing, because Ujjayi Pranayama is a very calming, quieting pranayama. Chin lock creates more relaxation. Left nostril breathing, it creates a powerful tool for your parasympathetic activation. So let me show it to you at least one time, so you're able to see and able to do it. Breathe out first. Take a deep breath in. Completely breathe out. There cannot be any better practice than this, with a complete relaxation, chin lock, left nostril breathing, Chandrabhedi Pranayama with the Ujjayi Pranayama. Guaranteed you will have a transformative experience. Bring your lung function better, you do against resistance. This one you are doing called resistive inhalation, Ujjayi Pranayama, like this. I did this, I didn't have any effort. When you have effort, we call it a accessory muscles of respiration starts working, which has not happened here. So you have to see that every pranayama should be effortless. Resistive exhalation is called your Shankha Pranayama. Shankha is a blowing of a conch shell. In our hand, what do we do? The hand, we do your two yogic fist. Remember, always breathe through your nostril. You don't breathe through your mouth. Because if you breathe through your mouth, you have no idea where the air has gone in. It may go in the lung, it may go into stomach, but in the nose, it goes to the nose, then it goes to your side of the nose, that is called a turbinate. It secretes nitric oxide from your sinus mucosa, then it gets directed exactly to the larynx and the trachea. It goes to the lung. If you at all have to do mouth breathing, you can always breathe in through your nostril, breathe out through your mouth. When you practice pranayama from the mouth, those are two, like a sitali, sitkari pranayama, do from the mouth, but those are two cooling down our body. So here is Shankha Pranayama, resistive exhalation. You breathe out first. Take a deep breath in through your nose. Breathe out through your mouth under resistance. Wonderful experience. Do one more time. Breathe out first. Breathe through your nostril. Shankha Pranayama. When you get very hot, like you get a hot flushes, you get a gastroesophageal reflux disease, you can do called a cooling, Sitali Pranayama, Sitkari Pranayama, Shadanto Pranayama. But basically, you breathe in through your mouth to cool inside. So you stick out your tongue, roll your tongue, breathe through your rolled tongue. And breathe out through your nostril. Breathe in through your rolled tongue. You just keep on doing it. Within a short time, you feel a profound level of cooling. If you cannot stick your tongue out, you can breathe through your teeth. Sitkari Pranayama. Shadanto Pranayama You can touch under the tongue in your upper palate and breathe through there. And you'll also see in the hand, initially in the mudras, hands a little curved up with the tone, but when you're practicing a pranayama also, the relaxation sets in, your hand will drop down without knowing. You do a chanting, also called Om Pranayama. You just keep on doing pranayama with the Om. Om. That extend your exhalation. If you want to show it to you one time, you'll understand what I'm saying. So I'm doing the one Om Pranayama with a prolonged exhalation. Breathe out first. Wonderful extension of exhalation. Finish a meditative pranayama called a Pranabhu Pranayama. In a Pranabhu Pranayama, we have the Om of the three component, A, U, Ma, A, U, M. There are three mudras. When you do a mudra like this, it is called a Dhanu Mudra when your hand is pointing up. When the hand is pointing down, it's called a Chin Mudra. It opens the lower part of the lung. When you close your hand, it's called a Chinmaya Mudra. It opens the middle part of the lung. Then when you put a hand inside, this is called a Adhi Mudra. It opens the upper part of the lung. So most of the time, your upper part of the lung is not properly opened up. So during practice, in all asana pranayama practice, I like to do this. But in a Pranabhu Pranayama, meditation pranayama, we do with three hand mudras. So let's practice with me with the last practice. Meditative pranayama called Pranabhu Pranayama. Chin Mudra with A. Breathe out first. Take a deep breath in from the lower part of the lung. Chinmaya Mudra from middle part of the lung, U. Adhi Mudra, upper part of the lung, Ma. Slowly bring your hands in front of your heart. Touch your little finger and the thumb and open up other 3 fingers. Padma Mudra. Anahata Chakra, Heart Chakra. Slowly bring it, connects your body, mind and spirit. Slowly bring it close to your heart. Heart is the site of the soul. A good pranayama practice brings the whole transformative power to convert from a rogi, disease, to nirogi, no disease, to yogi, person with complete wellness and health. Yoga therapy is a wonderful practice. Slowly bring your hands again, put your hands together. Is called the Namaste. I honor the divinity within you. Slowly rub your hands, and you feel the heat in your hands. If you're wearing glasses, remove your glasses, put your hands over your eyes like a cup. Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, massage your face, behind your ear with auricular branch of vagus nerve, in front of your neck, the carotid sinuses, behind your neck, your trapezius and sternobastia muscle. Wonderful practice. It's a conscious breathing. It is a voluntary regulated breath. And remember, it is not a breathing exercise. We do not recommend any exercise from your breath. It is your voluntary regulated conscious breathing which will cause your transformative power. Thank you for joining. We'll see you again on the next Saturday, and I'm all set. Thank you everybody who has told me that everything is working, sound is good, no technical mishaps. So we'll see you again Saturday for another session of yoga therapy.